This is Dr. Sunabha, your OBS-GYN faculty. I did my MS from JITMA, followed by DNB. So let us discuss a very frequently asked question and often confusing for you. Many of you have written me to explain this topic: vaginal infection. So there are very simple, vaginal infection. There are only three things that you need to know. One is bacterial vaginosis. The other one is Trichomonas vaginalis. One is Trichomonas vaginalis, and the other one is Candida. And the differentiation is very simple, that you need to look at only these three things. So discharge, smell, itch, and if they give you the wet mount specimen, how it looks like, well and good. So how are the discharge? So the color of the discharge. Bacterial vaginosis has grayish thin discharge, right? Grayish thin discharge. Whereas Trichomonas vaginalis is greenish frothy discharge. Greenish frothy discharge. So focus on this frothy more and greenish less, because in clinical examination also the green you will find is a lighter shade of this green. So it will not be often, and only experienced eyes will be able to differentiate between the green. It is not like the parrot green of Pseudomonas infection, right? So it is a lighter shade of this kind of a green. So don't focus on the green for exam purpose, as well as if they tell green, that is fine. But in exam purpose or clinical purpose, greenish should not be your focus, but focus on the fact that it is frothy, right? And Candida is cardi white thick discharge, which is adherent to the vaginal wall, and if you try to scrape this adherent discharge off, there might be petechial red bleeding spots, right? So coming to the next factor, smell. So bacterial vaginosis, this is foul smelling, this is foul smelling as well, but Candida is usually odorless. Coming to itch. Bacterial vaginosis does not cause itching. Itching is very prominent in case of Trichomonas vaginalis, where itching will be so severe that she will itch her vulva and vagina to red inflamed feature, which is known as the strawberry vagina. Itching is also a prominent feature of Candida, but itching is not seen with bacterial vaginosis. It's just foul smelling, grayish thin discharge. So this is the strategy to remember, right? So if it is a gray discharge, foul smelling but no itch, it is bacterial vaginosis. If it is foul smelling and itch is also there, it is Trichomonas. And if it is not foul smelling but itchy, then it is Candida. As simple as that, even without knowing the color of the character of the discharge. So if they give you the wet mount specimen, so these both are I hope previous year images. So this is the trophozoite form. Trophozoite is the only form of the Trichomonas. So this is the trophozoite form of Trichomonas, which may be seen on the wet mount. Whereas in case of Candida, fungal hyphae will be visible. If we look at the clinical picture of bacterial vaginosis, the wet mount picture, we will be able to see epithelial cells studded with small dot-like organisms. Studded with organisms. So this picture is known as a clue cell. And from this image, Nugent score can be plotted, which will further clench the diagnosis. So this is clue cell, this is the trophozoite form, and in case of Candida, we will be able to see fungal hyphae. So coming to treatment is very simple. So bacterial vaginosis is a hygiene disease. It happens because of repeated vaginal douching, which depletes the normal vaginal flora. So treatment is probiotics. Avoid excessive hygiene issues, particularly douching with soap, water, alkaline things, and drug of choice is metronidazole. Coming to Trichomonas vaginalis is metronidazole 2 or secnidazole or tinidazole, whatever it is. But this is an STI and partner treatment is required. On the other hand, Candida, if it is a simple Candida, non-recurrent without any risk factor, then the treatment is fluconazole single dose. I hope this was useful. All the best for your upcoming exams. Let's play the game. Thank you.